Okay, welcome to our weekly 3-Minute Therapy podcast with me, Dr. Michael Edelstein, clinical psychologist, and my co-host, Mick Berry. And we discuss subjects related to REBT, Rational Emotive Behavior Therapy. And the first principle is our emotions and behaviors come from our thinking about situations, not from situations themselves. And normally when we have disturbed emotions or dysfunctional behaviors, it comes from a particular type of thinking. That's thinking in terms of musts, demands, supposed tos, shoulds, have tos, got tos, demands we put on ourselves, others, and the world. And when we put a demand on ourselves, it normally is in the form of, I absolutely must do well and get approval, or else I'm no good. When we put a demand on others, it takes the form of, others must treat me fairly, kindly, and considerately, or else they're no good. And then the third category is a demand on the conditions of one's life. My life must go well, easily, not boring, and hassle-free. And if it doesn't, it's no good. And that third demand often leads to procrastination and addictions. Today, we're honored once again to have as our guest Dr. Aldo Pucci. And Aldo is a practitioner of rational living therapy, which has much overlap or maybe identical with REBT. We'll find out about that shortly. So Aldo, do you want to say anything about yourself, an introduction?
Oh, well, I appreciate it very much. Thankful to be on your podcast once again. I'm president of the National Association of Cognitive Behavioral Therapists, and an association that's based in the Pittsburgh, Pennsylvania area, about 35 miles west of Pittsburgh. And we conduct trainings and seminars, workshops, mostly online nowadays, in cognitive behavioral therapy, and I focus on rational living therapy. And I was trained originally by Maxie Maltby Jr., who was a psychiatrist, a physician, and actually started out as a private practice physician, and decided that he might as well go into psychiatry because he spent a lot of his time actually counseling these patients. And found that many of them did not have a physical, couldn't identify a physical cause for their physical problems, and noticed that when he counseled them, they seemed to do better physically. So I got into psychiatry and studied psychosomatic medicine, and then realized that studied under Grayson Graham, and realized that that Albert Ellis's ABC model fit perfectly with what he learned and understood about psychosomatic medicine. And so studied under Ellis, and then I had the great fortune of being trained by Maxie.
Okay, great. And is there, and you've taken Maxie's RBT, Rational Behavior Therapy, and modified it a bit and made it into rational living therapy. Is that correct?
Yes, it's not like I had set out to do that, but much like Maxie's experience with Ellis, Maxie decided that it was no longer fair to Ellis to call what he was doing rational emotive therapy at the time, or now rational emotive behavior therapy, because of how he had gone off in other directions and whatnot. And so that's why he called his approach rational behavior therapy. I had the same experience with Maxie, and various things that I did that I realized it was really no longer RBT, and so decided to call it rational living therapy.
Okay, Mick, did you have any questions?
Just that I'm interested in what the differences are, and also if the differences are pronounced enough that they're superior. I've got a lot of questions about, obviously the goal is to have somebody leading a pretty much emotionally healthy life. I mean, that's
Sure.
the goal. I found out about cognitive therapy from David Burns's book, Feeling Good, and I was quite impressed. I found it very useful. But then I got into rational motive behavior therapy from Emmett Felton, the therapist I found in a list of cognitive therapists. But I found that there were some things about it that David Burns did not cover, such as secondary disturbance, demands about demands. And I was doing that and not realizing I was doing it, and I was very confused. Well, cognitive therapy helped me so much. Why is it not helping me now? And the reason was I was making demands about my demands. And then I also learned from REBT, I'll try to stop talking because you're the guest and we want to hear from you. But I also found from REBT, David Burns lists 10 cognitive distortions. Ellis says there's really one. It's a demand. That's what it is.
Yes, and of course, one of the differences between REBT and RLT and RBT and cognitive therapy, which now they're trying to call cognitive behavior therapy, but it was originally called cognitive therapy, is that the rational approaches emphasize philosophy, seeking to identify the philosophical error in the person's thinking rather than just some mistake. For example, and what I explain to therapists, to produce a deeper solution to the client's problem, to help the client to get better rather than just feel better. What draws a lot of therapists to the cognitive approaches are examples like illustrations, like someone walks past a group of people and those people start laughing at them, and the person jumps to the conclusion they must be laughing at me. And so what sounds like good therapy to these therapists and what attracts them is this idea, well, see, you're making the mistake of jumping to conclusions, more specifically mind reading, right? What evidence is there that they were laughing at you? It could have been a coincidence. They could have been laughing at somebody else. So you might as well drop it. What I want to know is, why are they still making themselves miserable a week later to tell me about it? And it's usually because of some idea, some philosophical idea that to be laughed at is a horrible thing. So once we correct that mistaken idea, then that will generalize to a lot of different situations, right? Not just walking past a group of people.
Yeah, Mick.
Yeah, so far I don't see any difference between REBT, because Albert Ellis and REBT would say the demand here is I must not be laughed at. It's terrible if I'm laughed at.
Okay,
So,
yeah, and that's that second part, right? Because for me, the demand itself, like for example, I must do well, otherwise I'm no good. But I like to take it a step further and to ask, well, what's the problem with that? If in fact you are no good, as far as you are concerned, why would that be a terrible thing? Because the assumption there is that to be no good is they must think it's a terrible thing. But what I want to know is, for them, why is it a terrible thing? You see, and then go from there. Right?
Yeah,
Yes.
Mick.
well, I could answer that. Now, tell me what you think of this. I mean, if I am now, I don't think it's possible for me to be no good at everything, but are you saying then that if I am actually no good at everything, why would that be a terrible thing? If that's
Right.
what you're asking, I could tell you I'd be a terrible thing,
Why that?
because life would be a huge, huge pain in the ass.
Okay.
Now, it wouldn't be
And then-
terrible. I could live with that, but I certainly would not be happy under those circumstances. If I'm now, however, I think
But it
you're
wouldn't be-
asking, I'd
it
like
wouldn't
to
be the end of
finish
it, right? Okay.
but I think you're asking a question here that is not in the realm of reality. It's impossible for me to be no good at everything.
Well, I suppose it is possible. It's very unlikely, but it's possible.
I don't think it would even be possible.
Well,
The
but
the reason it wouldn't be possible, Aldo, is because if you were no good at everything, one of the things you'd
You would be great
no
at
good
is
at would be
being-
keeping yourself alive, and you'd be dead. So
Yeah, right. I
obviously
mean,
you're good at certain
and
things.
obviously this is a philosophical debate. But the point being is what I want to know is more specifically for this person, why do they believe it's a horrible thing? And usually what they mean by when they say horrible, terrible, and awful is it's something I couldn't take, I couldn't stand, which ultimately the reaction that they have is the same they would as they would if they were in the woods, they turned around and a bear were ready to attack them. You can, you can see it in their actions and their reactions that they're equating something with a life or death situation. So in RLT, that's what we work at getting at, and work at correcting that. And so that's a similarity. I just think maybe in RLT, sometimes we take it a step further.
Mick, if you don't mind, I'd like to move on to something else. And the main
Well, I have a
reason,
big question about this, though, because we're
Okay.
talking
yeah, we have
about the
limited time, so
differences.
try to make it
And
brief.
I want to say something. I still don't see a difference because REBT says address the thought, I can't stand it. So right now, I don't see a difference.
Yeah, yeah, and I don't claim that there's a difference between the two there. Yeah,
Oh,
Okay,
you don't
so
claim there's
yeah,
a difference?
I said I
Mick, we
don't
have
claim
Mick, we
there's.
have limited time, and I wanted to go on to something else, which is the reason I
Go
asked
on.
Aldo to be our guest. Is that Aldo? You have a workshop coming up, is that right? Called "How to
Yeah,
Be the
yeah,
Best CBT Therapist You Can Be."
right. That's right.
And what are the main points you'll be making in that workshop for therapists that they could use to be the best CBT therapist?
Well, yeah, there are quite a few. One of them is one of the things that a person can do to be the best therapist they can be is to learn how to listen to the client, to hear what they're saying, and to pay attention to the thoughts that they're expressing about their situation, their circumstances. Right? The second is to be inquisitive. For example, I supervise a lot of therapists, and it's interesting to me that sometimes they'll say to me like the client reported that they felt much better this week, and they'll just leave it at that. What I wonder is why. Why did they do much better? Was it for a rational reason? Was it an irrational approach? If they approached it rationally, then their understanding why they're doing well is important, so they can replicate that. So it's that, and so many times therapists will say, and Michael, you might have noticed this in our supervision that we have, our group supervision we have. So many times therapists will say, "I didn't think to ask that at the moment," because there's just not that curiosity for how the person came to feel this way, how they came to behave this way. Another is a way that you could be the best CBT therapist you can be is to have a coherent system. A lot of what I see, because I think it's what a lot of what mental health professionals think is that CBT, so to speak, is just a collection of tools. And so you have this toolbox with these tools, and it's kind of a random application of these different tools, when in fact there's a system, a coherent system. And part of what the coherent system does is helps you to avoid putting the cart before the horse. For example, so often therapists will jump right into disputing thoughts before they've taught the client that our thoughts cause our feelings and behaviors. And that leaves the client wondering, why are we talking about my thinking? I want to talk about my situation. So without a system, the client, that's very easy for the therapist to put the cart before the horse, trying to learn calculus before you've learned addition and subtraction, that sort of thing. Another way that therapists can be the best therapists they can be is to help the client to well, first of all, identify irrational thoughts, help them to understand why they're irrational. Because one of the things that I've noticed is that sometimes they'll just say, well, that's irrational without explaining why. And then helping the client to develop an alternative way of thinking, a rational replacement thought. for them to practice. And that's the other part of it too, is sometimes they fail to ask the client to practice this new thought. Reading it every day, imagining themselves in the relevant situation, thinking the new way and feeling and acting the new way as a result. Let's see. Another problem, and I know something that you've talked about, Michael, that hinders or keeps therapists from being the best they can be, is they have their own irrational thoughts. And so the problem with that is they fail to recognize the irrational thoughts in their clients that they have themselves. And certainly they're not going to argue against something that they believe themselves. So by us applying the rational technique to ourselves, we will be in a much better position to help people to recognize their irrational thoughts. Something that I noticed as well that tends to stand in the client's way of being the best, the therapist's way of being the best therapist they can be, is to be a bandwagon therapist. They tend to jump on the latest craze, the latest popular technique. And sometimes the reason they do this is because they do not stick with what works. We know that our thoughts cause our feelings and behaviors. We know that when we help people to identify their irrational thoughts and help them to correct those irrational thoughts and to practice a new way, we know that all works. But sometimes therapists will abandon that because they're not patient enough. I know of one person who was actually a fellow of the Albert Ellis Institute, who told me that he pretty much, for years, who told me that he pretty much abandoned examining and disputing thoughts with clients because he just got tired of, them not, the work, the effort. So that's, you know what I mean? Yeah. So that's why he got more into the mindfulness kind of thing, and I just got tired debating people all the time. Yeah. So mindfulness sounds kind of nice, doesn't it? They would just have them be mindful of something else and, and all, and we don't have to dispute anything, that sort of thing.
Mick, one last brief word, because we're against the clock here.
Yeah. So far, Aldo, I don't see any difference between REBT and rational living therapy. And also, I've noticed, yes, this is something that people want to get involved in, what the latest craze is. I think it's very, it's not productive to, personally, I don't see a reason to call what you're doing rational living therapy. This is maybe something to talk about in a later podcast, because now there's no reason to call it anything but REBT.
Well, honestly, I didn't know that we were going to discuss differences. I could have been prepared to present that. But look, I'm not concerned with. I'll just leave it at that.
Bottom line is help somebody get better and stay better and be mentally healthy.
Right. But the flip side of it is if I called what I did REBT, there would be a lot of people who would say REBT therapists don't do this and REBT therapists don't do that.
Well, so they'd be wrong.
You're going to get it from both sides, Yeah.
Okay, Aldo, and you had mentioned group supervision, plus you have a seminar coming up called How to Be the Best Therapist, Cognitive Behavior Therapist You Can Be. How can people get involved with either or both?
Yes, certainly. To visit nacbt.org. That's nacbt.org. And you'll find links on there to how to join the association. And our group supervision is on Mondays at 2 p.m. Eastern, and we have a great time discussing cases and talking about trying to answer general questions and all that as well. And on the website as well as a link to the to register for the webinar coming up next week.
Are you also seeing individual clients?
I am, yes, doing some consultations
Yeah.
and individual supervision as well. Yes.
So if you'd like to have a session with one of the best cognitive behavior therapists around, contact Aldo, and he'll be happy to help you over your emotional and behavioral problems.
I appreciate that very much. Thank you.
Okay, thanks very much,
right.
Aldo, for being our guest. Thanks, Mick, for co-hosting this, helping me with this. Thank you, Chris Rossini, our tech engineer. Comment below. Give us a thumbs up if you like this. Suggest subjects we could use in the future. Volunteer if you'd like to be on with us to discuss some issue related to therapy or your own emotional problems or helping a client of yours. And subscribe to the 3-Minute Therapy podcast to do what, Mick?
To stay on the rational side of life.